بسم الله الحمد لله والصلاة والسلام على رسول الله رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي السلام عليكم. I'm going to talk about social anxiety, which is also called kind of social phobia, because this is something that's very common and causes significant impairment in terms of quality of life and interpersonal difficulties. So, what is social anxiety? Well, there's many definitions. One of the definitions I like is the fear of being judged and evaluated negatively by other people, which leads to feelings of inadequacy or inferiority, self-consciousness, embarrassment, humiliation, and depression. So, if an individual usually becomes irrationally anxious in social situations, but seems better when they're alone, then social anxiety may be the issue. Um, so it's very common. Social anxiety disorder, which is also called social phobia, is a much more common problem than past estimates have led us to believe. So millions of people all over the world suffer from this devastating and traumatic condition every day, either from a specific social anxiety or from more generalized social anxiety. So, for example, in the US, epidemiological studies have shown that social anxiety disorder is the third largest psychological disorder in the country after depression and alcoholism. Estimates around 7% of the population suffer from some form of social anxiety, and the lifetime prevalence rate for developing social anxiety disorder is between 13 to 14%. Okay, so as I mentioned, it's normal to feel nervous in some social situations. For example, when you have an exam or you're talking in public. But in social anxiety disorder, everyday interactions cause significant anxiety, self-consciousness, and embarrassment because you fear being scrutinized or being judged negatively by other people. So what are the symptoms? Well, feelings of shyness or discomfort in certain situations aren't necessarily signs of social anxiety, particularly in children. And comfort levels in social situations vary depending on personality, temperament, and life experiences. So in contrast to this kind of normal everyday nervousness, social anxiety disorder includes fear, anxiety, and avoidance, which interferes with relationships, daily routines, work, school, and other activities. And typically, social anxiety begins in early to mid teenage years, although sometimes it can occur in younger children or in adults. So you have emotional and behavioral symptoms. So signs and symptoms of social anxiety disorder can include constant fear of situations in which you may be judged negatively, worry about embarrassing or humiliating yourself, intense fear of interacting or talking with strangers, fear that others will notice that you look anxious, fear of physical symptoms that may cause embarrassment, such as blushing, sweating, trembling, or having a shaky voice, avoidance of doing things or speaking to people out of fear of embarrassment, avoidance of situations where you might be the center of attention, anxiety and anticipation of a feared activity or event. So, for example, if you're going to be doing a presentation or you're going to attend a marriage function or any kind of gathering where there's a lot of people, the lead up to it, anticipatory anxiety causes issues as well. And anxiety and anticipation of a feared activity or event, like I said, intense fear of anxiety during social situations, analysis of your performance and identification of flaws in your interactions after a social situation, and expectation of the worst possible consequences from a negative experience during a social situation. So for children, anxiety about interacting with adults or peers may be shown by crying, having temper tantrums, clinging to parents, or refusing to speak in social situations, becoming mute. Performance type of social anxiety disorder is when you experience intense fear and anxiety during speaking or performing in public, but not in other types of general social situations. So you have these emotional and kind of behavioral symptoms. You also have physical symptoms, and these can include blushing, um, increased heart rate, trembling, sweating, upset stomach or nausea, trouble catching your breath or shortness of breath, dizziness or lightheadedness, feeling that your mind has gone blank, and muscle tension. And then you have avoidance type symptoms. So this is where you interact with unfamiliar people or strangers. So you find it hard to endure this. You find it hard to attend parties or social gatherings. People find it hard to go to work or school, find it difficult to start conversations, making eye contact, entering a room in which people are already seated, eating in front of others, and using kind of public facilities. Okay, so what about kind of diagnosis? Well, as I've mentioned in my previous videos, we use the DSM, the Diagnostic Statistical Manual, or the ICD-10, to diagnose mental illness. So the DSM-5 criteria for social anxiety disorder includes persistent, intense fear or anxiety about specific social situations because you believe you may be judged negatively, embarrassed, or humiliated. Avoidance of anxiety-producing social situations or enduring them with intense fear or anxiety. Excessive anxiety that's out of proportion to the situation. Anxiety or distress that interferes with your daily living. And then fear or anxiety that is not better explained by medical condition, medication, or substance abuse. So what about treatment? Well, it really depends on how much social anxiety disorder affects your ability to function in daily life. So some people can actually manage, and it causes kind of minimal impairment, but other people become completely kind of disabled or debilitated because of social anxiety disorder. So treatment options are psychotherapy, which is talking therapy, medications, or a combination of both. So what about psychotherapy? Well, it improves symptoms in most people with social anxiety disorder. So in therapy, you will learn how to recognize and change negative thoughts about yourself and develop skills to help you gain confidence in social situations. Cognitive behavioral therapy, CBT, is the most effective type of psychotherapy from the literature and research for anxiety, and it can be equally effective when conducted either in individual sessions or in group sessions. So in exposure-based CBT, basically you gradually work up to facing situations you fear the most. So this can improve your coping skills and help you develop the confidence to deal with anxiety-inducing situations. You may also participate in skills training or role-playing to practice your social skills and gain comfort and confidence relating to others. And practicing exposures to social situations is particularly helpful to change your worries. What about medication? Well, we have several medication options available. Selective serotonin reuptake inhibitors, SSRIs, are the first line treatment for persistent symptoms of social anxiety. So examples include sertraline, also called Zoloft or paroxetine. So that's an option. We also have serotonin and norepinephrine reuptake inhibitors, SNRI, such as venlafaxine or FXR. This is also an option. To reduce the risk of side effects, you usually start on a low dose and gradually increase the dose, and it can take several weeks to even months to get up to a therapeutic dose. We also have other medications we can use, for example, other antidepressants. We have different types of antidepressants that can be effective with fewer side effects. Anti-anxiety medications such as benzodiazepines, they may reduce your level of anxiety. Although they often work quickly, they can you can become addicted to them. So it needs very careful prescription and monitoring. And then we have beta blockers. These basically medications block the stimulating effect of adrenaline, which reduces heart rate, blood pressure, kind of palpitations and shaking of voice and limbs. So it's usually used as a PRN, as required medication, and it's very effective. The important thing is if you are on medication, you need to stick with it. Otherwise, you can decompensate. Usually the best evidence is a combination of talking therapy and medications. Okay, so that's a very kind of whistle-stop tour through social anxiety disorder, social phobia. Like I mentioned at the beginning, it's very common, and people don't seek help when they should. And as I've always said with mental illness and behavioral issues and psychological problems, if there's anything that you take home from my video today is really to seek expert intervention as soon as possible, because the longer you leave things, the harder it becomes to treat, and just causes significant difficulties. And it's important to recognize anxiety within yourself and within your family, and there is very good treatment for this issue, but early intervention is the key. So inshallah, until next time, This is your brother, Dr. Abu Isa. Assalamu alaikum wa rahmatullahi wa barakatuh.